I've been a nurse for 30 years. 18 of those years I worked in the NICU, and 12 years I worked in school health. There are many significant problems that can happen. And I think when people think of a baby being born, they just automatically think that's a happy and exciting time. But there are all kinds of complications that can happen to the mother and the baby. And some happen during utero, like the baby's development is not occurring correctly, and others occur at delivery. And for instance, there's been babies that are born without a brain. They have a skull, but they have no brain. Somehow surviving in a sense, but they are requiring a lot of advanced life support in order to live. There are babies who have severe bleeds or hemorrhages when they're delivered, and their brains will never develop. Depending on the severity, they most likely will require a variety of things to keep them alive. And those are lifelong care situations. Many of them may be required to stay on ventilation, or like a ventilator machine to help them breathe. So it's a challenge for the parents. How do you even sleep? And when I say parents, oftentimes the stress of this delivery will sometimes pull people apart. So it's usually the mom who is left with the baby. So it will be the mom taking care of the baby who's on a ventilator day and night, or who's requiring feeds through a tube and a life in a wheelchair. I was 32 years old, and my husband and I were expecting our third baby. We had a 4-year-old son and a 3-year-old daughter, and we were very excited about the pregnancy, so we invited my mom to come along for the ultrasound that was scheduled. And I was about 17 weeks. It was a regular prenatal ultrasound that was scheduled. And partway through the exam, I knew that the tech was having some concerns. She was taking longer to do some measurements and remeasurements, and then she left the room and came back into the room with the doctor, who explained that based on some of the findings from the ultrasound, they knew there were problems with the baby's medical health. They could determine that the baby had some significant, serious medical problems, but in order to confirm how severe the complications could be, and whether or not it was related to anything else, we would have to do an amniocentesis. The amniocentesis we had done that day, but the hard part was that it was a week before we actually got the results of that. The minute the doctor had come into the room, I felt very vulnerable. I knew that something ominous was about to happen. You feel, my mind was reeling. I will never forget that moment and that day. A week later, that my doctor called and said that the amniocentesis showed that the baby had what's called trisomy 18, and it was the full version, meaning all the chromosomes are triple, and the life expectancy is, it's a fatal condition. Many women don't even go to carry on the pregnancy. They often miscarry. There's nothing that anyone can do to change that condition. It was horrible. We then had to decide what we would do. And thankfully, my doctor discussed with me my options. And then my husband and I talked about that and decided that we were going to schedule the abortion, which is what my doctor had recommended. She said, you realize what's going to happen and you know how this is going to go. As a nurse who works in a NICU, I'm very familiar with what it looks like for a family to have to go through something like this. And I feel very strongly that each person is different and each person has their own choice. And for my husband and I, we felt that the best choice for our family and for our baby was to do this. Meanwhile, between talking with my doctor and having that scheduled, I had already started to miscarry. So within a few days, I was in the hospital delivering the baby early. It was just horrible. This decision involves the entire family. And anytime there's something that happens to one person in the family, it really happens to everyone. So I had to consider the thoughts and feelings and development of my other two children. So my son, who was very inquisitive, I knew was, sensing something was wrong, and my daughter as well. And as it was during the time of trying to manage understanding what the doctor was saying and what was happening to us, I was really not available to my family. I was shutting down, I was depressed. I did surprisingly have some pressure from some family. And, they made a little bit of remarks about, well, I could handle anything. I would never choose having an abortion because I could handle anything. And I really do believe that unless someone has ever been through that experience, you just never know what you would choose to do. And when you're faced with those circumstances, you really do think of everything. You think of your unborn baby's health and what's going to happen and how your other children are going to respond and behave, and how are you going to respond and behave, and are you going to be available to everyone? And sometimes you don't come back from those things. And I've seen that happen working in the NICU, where women struggle with their mental health after a challenging delivery or a problem. People do suffer post-traumatic stress syndrome from this. And I was very afraid of having something like that happen, and it was hurtful to have someone say that to me. It almost stopped me from talking about it with other people because I didn't have the strength to answer their questions or to defend myself. Over the years, between working in the NICU and even working in the school, I've seen families deliver babies with very bad outcomes. And some of them, because of maybe they were afraid to withdraw support. I know it is an option. Doctors will give families an option if the baby has a significantly poor outcome. It's very situational, each one is individual, but some families feel pressure, honestly, from their own families to bring the baby home and try to bring the baby home. It may not be what they honestly want. They may not know what they're getting themselves into. And I feel like it should be explained more to them, because once they leave the hospital with a baby that has serious medical problems, they are left to take care of that baby on their own, or with what limited support they may have. I've had a lot of young moms, 19 to 20, taking home on their own a severely disabled baby, and they have no support. They have now had to quit their job in order to care for the baby. It's an obstacle just to even leave the house. Whether it be a miscarriage or a baby born with medical complications. These are all very stressful events. There should be counseling available on the spot and for afterwards. Information given to the moms that they can follow through on after they leave, but it needs to be started while they're in the hospital. It seems like common sense that it would be available to everyone, but it's not. And insurance really doesn't cover everything that you think it should. Even some moms taking home a premature baby or a baby and having issues with lactation. I feel as though people who haven't been or don't have experience, perhaps lawmakers, sometimes even family, they don't always give sound advice. And there are so many situations that are very different if people don't have the resources to care for this baby after the baby is born, or to help the mother through the mental and emotional challenges that she's going to face after the baby is born. You could take a completely healthy, happy family, and mentally they could be hurt from this time in their life. Again, it's like post-traumatic stress syndrome, and there aren't enough resources out there to help her to deal and cope and face everyday challenges, both financially and medically for herself and the baby.